Hi, my name is Serena and I did prostate cancer. Some ways a person can develop prostate cancer would be if they eat a large amount of red meat or fat, if a male has an elevated PSA level or a high level of testosterone. Smoking and family history are other causes of prostate cancer. And lastly, if a person has other health issues. The demographics for prostate cancer are typically men over the age of 65. However, there have been rare cases men between the ages of 30 and 40 have developed prostate cancer, but that usually happens if they have a family history of the disease. And lastly, African American men are more at risk for getting prostate cancer. African American men are more likely to, or twice as likely to die from the disease than other men. In a study, I found 0.40% versus 0.22% of men died of low-grade prostate cancer, and 1.44% versus 1.35% of African American men have died of high-grade prostate cancer. In this image, at the top is a normal prostate next to an enlarged prostate. The bottom image shows the enlarged prostate blown up with the prostate cancer cells inside of it. That is the white little circle that's inside of the prostate. That is the cancer cells. There are different stages of prostate cancer. This is stage 1 and stage 2. You can see in stage 1, the white cell inside the prostate is very small. And then in stage 2, it's much more enlarged. The deadliest stage would be the last stage of prostate cancer. And if a male ends up having this, the prostate cancer will then spread through the whole body, such as the lymph nodes, the bladder, the rectum, and their pelvic wall. Prostate cancer spreads in 3 different ways. It spreads through their tissues, the lymph nodes, and the blood vessels. First, it spreads through the tissues by infecting other nearby tissues. Then it spreads through the blood vessels and the lymph vessels. Some symptoms of prostate cancer would be if a patient had the sudden urge to urinate, had trouble urinating or like starting to go, had a weak or stop and go flow, had blood in their urine, had pain while they're urinating, or have had any back, pelvic, or hip pain. Some diagnosis of prostate cancer would be done during a blood test, specifically a PSA level. Once they get the PSA levels back, it will then let the physician know if they are in range or if they are abnormal. If the PSA levels are abnormal, the physician will then decide to do an ultrasound, an MRI, or a rectal exam. If an ultrasound is done, it's typically done with a biopsy. This means that they will go through the rectum with the probe and insert a needle into the prostate and take samples of the infected area of the prostate. They will then send those samples to a pathology or a lab, and the pathologist there will then grade how aggressive or non-aggressive the cancer is possibly. Grading levels vary from 6 to 10, 6 being low-grade cancer cell and 8 to 10 being high-grade cancer cells. There are different treatments for prostate cancer, such as localized prostate cancer, which would be radiation or surgery of the prostate, or even removal of the whole prostate. There are hormonal drugs, and lastly, there is also chemotherapy for aggressive prostate cancer. And these are my references, and I hope you enjoyed my slide. Thanks.